A real misnomer for parents is that strep needs to be treated because it'll make their child feel better. Well, in reality, strep is self-limited and it's a disease that will go away untreated, but it's so important to treat, not just because we want the kids to feel better, which we do. Also, they don't communicate the illness once they've been on antibiotics, typically for about 24 hours, but by far the most important reason why we're treating strep is to prevent what's called rheumatic fever. And rheumatic fever is not common in the United States, but the literature says about 1 to 2% of untreated strep patients can get rheumatic fever. And the reason we're so worried about rheumatic fever is because they can get heart problems. So you have about 9 days from the time of symptoms and diagnosis to diagnose and treat and prevent rheumatic fever. So it's important to treat to prevent the rheumatic fever. Now, there's a lot of other complications of strep, and strep can cause kidney problems called glomerulonephritis. So if your child is peeing blood 3 weeks after a strep infection, that's important to remember that they had strep. Heart problems, but it can also cause complications, peritonsillar abscess or a pocket of pus behind strep. So have strep throat can be the beginning of a really bad infection in the throat. It can also cause some weird things like PANDAS is in the news, and there's some neuropsychiatric problems that can occur because of the strep bacteria. So strep can cause a lot of different problems, and it's really important to treat it. Fortunately, we have some really good medications that we can easily eradicate it, but more importantly, diagnosis, because you cannot always tell just by looking at the throat. I'm always shocked, wow, that kid had strep throat, because it wasn't even terribly red. They just vomited once and it turned out to be strep. So it's really important to use our diagnostic tools. Most places use a quick strep test, and that captures about 90%, but can miss about 10% of the kids. So we also have 2 other ways of doing it. We used to send off a culture, which took 3 to 4 days to come back, which was really frustrating for parents when their child had 3 to 4 days of fever and the child would not be treated because the quick strep was negative and the culture would come back positive a few days later. But now we have a special test called a molecular strep test that we can get the results well within 24 hours. So within 24 hours, we'll be able to confirm whether your child does or does not have strep, and it's even more sensitive than the old culture, and it comes back way faster, and it's actually cheaper. So it's a great test, and we've captured a lot of strep that the quick strep test missed, and we caught it within 24 hours. So it's been a real satisfying to us as clinicians, but also to parents.